Have you ever wondered if a surgery that seems routine could actually shorten your life instead of improving it? Every year, millions of older adults are told they need an operation. Many of these procedures save lives and restore health. But here's the important truth. Not every recommended surgery is the right choice, especially after the age of 65. So in many cases, the greatest risk isn't the disease itself. It's the stress that a major operation places on an aging body. As we grow older, the body changes in ways that are not always obvious. The heart has to work harder. The lungs may not recover as quickly. The kidneys process medications more slowly. Muscles become weaker, healing takes longer, and the immune system is not as strong as it once was. Even the brain becomes more sensitive to anesthesia, increasing the risk of confusion, memory problems, and slower recovery after surgery. That doesn't mean seniors should avoid every operation. Absolutely not. There are many surgeries that are life-saving and absolutely necessary. The key is understanding the difference between a surgery that truly improves both the length and quality of life and one that may bring more harm than benefit. That conversation is one of the most important discussions you can have with your doctor. One of the biggest mistakes families make is assuming that surgery is always the next logical step. Sometimes they hear the words, "This is the standard treatment," and immediately agree without asking deeper questions. But medicine is never one size fits all. What works for a healthy 50-year-old may not be the safest option for an 80-year-old with diabetes, heart disease, or kidney problems. Think about it this way. Surgery is like asking your body to run a marathon. A young, healthy person may recover quickly from that challenge, but an older body with multiple medical conditions has a much smaller reserve. Every organ has to work overtime to recover from blood loss, inflammation, pain, medications, and anesthesia. If those reserves are already low, recovery becomes much more difficult. This is why doctors today increasingly talk about something called frailty. So frailty is not simply about age. It is a medical condition where the body's ability to handle stress becomes significantly reduced. A 70-year-old who exercises every day may tolerate surgery far better than a 65-year-old who rarely walks, has poor nutrition, and struggles with multiple chronic illnesses. Physical activity is another powerful medicine. You don't have to become an athlete. Even regular walking, gentle strength exercises, and breathing exercises improve circulation, lung function, and muscle strength. These simple habits prepare the body to handle the physical stress of an operation much more effectively. Before agreeing to any operation, seniors should ask a very important question. What happens if I don't have this surgery today? And sometimes the answer is that delaying the procedure by a few weeks allows time to strengthen the body through better nutrition, physical therapy, better blood sugar control, or improved heart health. Those few weeks of preparation can make an enormous difference in recovery. Nutrition is often overlooked, but it plays a huge role in surgical success. Many older adults simply do not eat enough protein. Without adequate protein, muscles weaken, wounds heal more slowly, and the immune system struggles to fight infection. So even a simple improvement in diet before surgery can reduce complications and speed recovery. Sleep is equally important. Poor sleep weakens immunity, increases inflammation, and makes recovery slower. Many seniors underestimate how much quality sleep affects healing in the weeks leading up to surgery. Improving sleep habits can be just as valuable as taking another medication. Medication review is another essential step. Older adults often take several prescriptions from different doctors. Some medications increase bleeding risk, others interfere with anesthesia or delay healing. A careful review with your physician or pharmacist before surgery can prevent serious complications. Another factor that deserves attention is emotional health. Fear, anxiety, and depression are common before major surgery. High stress hormones can negatively affect recovery. Families play a huge role by providing reassurance, helping seniors stay active, encouraging healthy meals, and asking thoughtful questions during doctor visits. The goal should never be simply surviving surgery. The goal is returning to an independent, meaningful life afterward. Sometimes the best decision is surgery. Other times, medications, physical therapy, lifestyle improvements, or careful monitoring may offer similar benefits with much lower risk. Throughout this discussion, we're going to examine 5 surgeries that deserve especially careful consideration in older adults. These are not procedures that should automatically be refused. Instead, they are surgeries that require thoughtful discussion, individualized evaluation, and a clear understanding of both the benefits and the risks. The more informed you are, the better decisions you and your family can make. The first surgery we'll discuss is one that surprises many people because it has become so common that most assume it's completely routine. Yet in certain seniors, it can lead to complications that may permanently change quality of life. Understanding who truly benefits and who should pause before agreeing can make all the difference. The first surgery that deserves careful discussion is spinal surgery for chronic back pain. This surprises many people because back surgery has become so common that it often feels like the obvious next step after months of discomfort. But for many older adults, especially those whose pain is caused by age-related wear and tear rather than a medical emergency, surgery is not always the answer. As we age, nearly everyone develops changes in the spine. The discs lose water, the joints become arthritic, and the bones may develop small spurs. An MRI can look alarming, but those images do not always explain the pain. In fact, many seniors with severe changes on their scans have little or no back pain, while others with mild changes may experience significant discomfort. This is why doctors should always treat the patient, not just the scan. When someone hears the words, "You have a slipped disc," or "Your spine is narrowing," it is natural to feel frightened. Many people immediately think that surgery is the only way to avoid becoming disabled. But in many cases, the body has an incredible ability to adapt. And with the right rehabilitation, inflammation can settle down, muscles can become stronger, and pain can improve without an operation. The challenge is that spinal surgery is a major physical stress. Older adults face higher risks of infection, blood clots, pneumonia, bleeding, and prolonged recovery. Bone quality may not be as strong, making it harder for screws and implants to hold securely. Healing takes longer, and regaining mobility can require months of physical therapy. Another concern is that surgery cannot always eliminate pain. Some patients experience significant improvement, while others continue to have discomfort even after a technically successful operation. This can be disappointing because many people expect surgery to completely remove years of back pain. Unfortunately, medicine cannot always promise that outcome. One condition that deserves immediate medical attention, however, is when severe back problems cause progressive weakness in the legs or loss of bladder or bowel control. These situations are different. They may require urgent surgery because delaying treatment could lead to permanent nerve damage. This is why every decision must be individualized. There is a big difference between emergency surgery and elective surgery for long-standing pain. If surgery is not immediately necessary, there are many ways to improve spinal health. One of the most effective is building core muscle strength. Strong abdominal and back muscles act like a natural support belt for the spine, reducing stress on the joints and improving balance. Maintaining a healthy weight also reduces pressure on the lower back. Even modest weight loss can decrease pain and improve mobility. Regular walking, gentle stretching, and supervised physical therapy often provide benefits that many people never expected. These approaches require patience, but they often improve both pain and overall health without exposing the body to surgical risks. Good nutrition is equally important. Bones require adequate calcium, vitamin D, and protein to stay strong. Seniors who are undernourished are more likely to experience delayed healing and weaker recovery if surgery eventually becomes necessary. Before agreeing to spinal surgery, ask your doctor several important questions. Is this operation being recommended because of a true emergency or because other treatments have not yet been fully explored? What are the chances that surgery will actually reduce my pain? What complications are most common for someone my age and health condition? How long will rehabilitation take? And what level of independence can I realistically expect? Afterward, these questions help shift the conversation from fear to informed decision-making. The best choice is not always the fastest choice. Sometimes taking a few months to improve strength, nutrition, balance, and overall fitness can lead to a much safer outcome if surgery is eventually needed. Remember, the goal is not simply to fix an image on an MRI. The goal is to help you walk comfortably, remain independent, enjoy time with your family, and preserve your quality of life. Those are the outcomes that truly matter. The next surgery on our list is even more common among seniors. Millions undergo it every year, and for many people it is life-changing. Yet, there are situations where the timing of the operation is just as important as the procedure itself. Understanding when to move forward and when to wait can have a major impact on both recovery and long-term health.
The second surgery that deserves careful consideration is knee replacement. There is no question that for the right patient, this operation can dramatically improve mobility and reduce years of pain. Many older adults return to walking, traveling, and enjoying daily activities that they had nearly given up. But the key phrase is the right patient at the right time. Agreeing to surgery too early or before preparing your body properly can lead to a difficult recovery and disappointing results. One of the biggest misunderstandings is that an X-ray determines whether you need a knee replacement. It does not. Many seniors have severe arthritis visible on imaging, but continue to function quite well with manageable discomfort. On the other hand, someone with less damage may experience intense pain that interferes with every step. The decision should be based on how much the arthritis affects your daily life, not simply how the images look. A knee replacement is more than replacing a worn joint. It is a major operation that places stress on the heart, lungs, muscles, and immune system. After surgery, your success depends heavily on rehabilitation. The new joint cannot do the work by itself. It requires strong muscles, consistent physical therapy, and determination to regain movement. This is where many seniors face challenges. If muscle strength is already poor before surgery, recovery becomes much more difficult. Standing, walking, climbing stairs, and maintaining balance all require strength in the thighs, hips, and core muscles. Without that foundation, even a perfectly performed surgery may not produce the outcome you hoped for. Weight also plays a significant role. Every extra pound places additional pressure on the knees with every step. Even a modest reduction in body weight before surgery can reduce stress on the new joint and improve recovery. Combined with gentle exercise and better nutrition, this preparation often leads to fewer complications and a smoother rehabilitation. Another important issue is diabetes. Poorly controlled blood sugar increases the risk of infection and slows wound healing. Before scheduling elective surgery, doctors often recommend improving blood sugar control because doing so can significantly reduce post-operative complications. Taking a few extra weeks or months to optimize your health may greatly improve your long-term outcome. Smoking, if applicable, is another factor that delays healing and reduces blood flow to tissues. Quitting before surgery allows the body to recover more effectively and lowers the chance of complications. Even improvements made shortly before an operation can make a meaningful difference. Many people also underestimate the importance of planning for life after surgery. Recovery does not end when you leave the hospital. You will need assistance at home, a safe environment to prevent falls, regular physical therapy, and patience as strength gradually returns. Having family members or caregivers involved in this planning can make the recovery period much smoother. It is also important to understand that pain does not disappear overnight. Some discomfort during healing is expected, and progress usually comes in small steps. Walking a little farther each week, improving balance, and increasing flexibility are signs that the body is adapting. Setting realistic expectations helps reduce frustration and keeps people motivated throughout rehabilitation. Before agreeing to knee replacement, ask yourself and your healthcare team a few thoughtful questions. Have I truly tried non-surgical treatments, such as physical therapy, weight management, supportive footwear, and appropriate medications? Is my pain preventing me from living the life I value? Am I physically prepared for several months of rehabilitation? These questions help ensure that surgery is being chosen for the right reasons and at the right time. For many seniors, improving overall health before surgery can be just as important as the surgery itself. Building muscle strength, eating enough protein, staying active within your limits, sleeping well, and managing chronic medical conditions all increase the body's ability to heal. Think of it as training before an important event. The stronger and healthier you are going in, the better your chances of coming out with an excellent result. A successful operation is not measured only by what happens in the operating room. It is measured by whether you can return to walking confidently, maintaining your independence, and enjoying everyday life with less pain. That should always be the ultimate goal. The next surgery on our list is one that many people believe is completely routine because it is performed so frequently. Yet in older adults with certain medical conditions, the decision requires much more careful thought than most families realize. Understanding the balance between benefit and risk may prevent unnecessary complications and lead to better long-term health. The third surgery that deserves thoughtful consideration is gallbladder removal. This is one of the most commonly performed operations in the world, and for many people, it is absolutely the right treatment. If the gallbladder is severely infected, has ruptured, or is causing dangerous complications such as pancreatitis, surgery can be life-saving. But for many older adults who have mild or occasional symptoms, the decision is not always as simple as it first appears. As we age, gallstones become much more common. In fact, many seniors have gallstones and never know it because they never cause any symptoms. These stones are often discovered by accident during an ultrasound or CT scan performed for another reason. Hearing that you have gallstones can sound alarming, but the important question is not whether the stones are present. The important question is whether they are actually causing problems. One of the biggest mistakes is assuming that every gallstone needs to be removed. That is simply not true. Many people live for years with gallstones without pain or complications. In those situations, surgery may provide little benefit while still exposing the body to the risks of anesthesia and recovery. When symptoms do occur, they often begin as episodes of pain in the upper right side of the abdomen, especially after eating a heavy or fatty meal. Some people notice nausea or bloating. Others describe a sharp pain that lasts for several hours before gradually improving. These symptoms deserve medical evaluation because they may indicate that the gallbladder is becoming inflamed. However, not every stomach discomfort is caused by the gallbladder. Acid reflux, stomach ulcers, intestinal disorders, and even certain heart conditions can produce similar symptoms. This is why a careful evaluation is essential before deciding on surgery. Treating the wrong problem with an operation will not solve the symptoms. For older adults, timing is especially important. If the gallbladder is infected and causing fever, severe pain, or signs of a blockage, delaying surgery can be dangerous. But if the symptoms are mild and infrequent, your doctor may recommend monitoring the condition, adjusting your diet, or performing additional tests before making a final decision. Nutrition plays a surprisingly important role here. Many people notice that reducing fried foods, processed meals, and very fatty foods decreases the frequency of gallbladder attacks. Eating smaller meals throughout the day, instead of one large meal, may also reduce stress on the digestive system. These lifestyle changes are not a cure for gallstones, but they can help manage symptoms while you and your doctor decide on the best course of action. Hydration is another simple but often overlooked habit. Drinking enough water supports normal digestion and overall health. Combined with maintaining a healthy weight and staying physically active, these habits contribute to better digestive function and may reduce future complications.
Perhaps the most important lesson is this: never rush into surgery simply because a scan found gallstones. Instead, ask your healthcare team, are these stones truly responsible for my symptoms? What happens if we observe them for a while? What are the risks of waiting compared with the risks of surgery? And those questions encourage thoughtful, individualized care rather than automatic treatment. Medicine is most effective when decisions are based on the whole person, not just a test result. Your age, overall health, daily function, symptoms, and personal goals all matter. Sometimes surgery is exactly the right choice. Other times, careful observation and healthy lifestyle changes are the wiser path. The next surgery on our list is one that often promises relief from chest discomfort and improved blood flow. It has saved countless lives in emergency situations. Yet, when performed electively in certain older adults, the benefits may not always be as clear as many people believe. Understanding when this procedure truly helps and when other treatments may be just as effective is one of the most important conversations you can have with your doctor.
The fourth surgery that deserves careful thought is the placement of a heart stent or coronary bypass surgery for stable heart disease. Let me be very clear from the beginning. If someone is having a heart attack, has severe chest pain that will not go away, or has a blocked artery causing an emergency, these procedures can be life-saving. In those situations, every minute matters, and delaying treatment can permanently damage the heart muscle. But there is another group of patients who are not having an emergency. They may have occasional chest discomfort while walking, or a stress test may show reduced blood flow. In these cases, many seniors believe that placing a stent or having bypass surgery will automatically help them live longer. The truth is more complicated. For some people, these procedures improve symptoms. For others, carefully managed medications and healthy lifestyle changes may provide similar long-term outcomes without exposing them to the risks of major surgery. This is why the conversation with your cardiologist is so important. The goal should never be to simply fix a narrowed artery seen on an image. The goal is to improve your health, reduce symptoms, protect the heart, and help you live an active life. Sometimes the best treatment is a procedure. Other times, the best treatment is controlling the disease through medication, nutrition, exercise, and careful monitoring. Older adults face additional challenges because heart disease rarely exists alone. Many also have diabetes, kidney disease, lung disease, or high blood pressure. These conditions increase the risks associated with anesthesia and surgery. Recovery may take longer, and complications such as infections, bleeding, irregular heart rhythms, or kidney problems become more likely. Another important factor is blood thinning medication. After a heart stent is placed, patients usually need medications that reduce the risk of blood clots. These medicines are extremely important, but they also increase the risk of bleeding. Seniors who are prone to falls or who need another surgery soon afterward require especially careful planning. This is one reason why every treatment decision should consider the whole picture rather than focusing on one blocked artery. Lifestyle is one of the most powerful forms of treatment for heart disease. It may not sound as dramatic as surgery, but its impact is remarkable. Regular walking, if approved by your physician, strengthens the heart muscle, improves circulation, lowers blood pressure, and increases energy. Even 20 to 30 minutes of moderate activity on most days can make a meaningful difference. Nutrition is equally essential. A diet rich in vegetables, fruits, beans, whole grains, healthy fats, and lean sources of protein helps reduce inflammation and supports healthy blood vessels. Limiting highly processed foods, excess sugar, and excessive salt can improve blood pressure and reduce strain on the heart. These changes are not quick fixes, but over time, they help protect the cardiovascular system. Managing stress is another piece of the puzzle that is often overlooked. Chronic stress causes the body to release hormones that raise blood pressure and increase the workload on the heart. Simple practices such as deep breathing, spending time with loved ones, enjoying nature, or engaging in meaningful hobbies can support emotional well-being and heart health. Before agreeing to an elective heart procedure, ask several important questions. Is this an emergency, or do I have time to think about my options? Will this procedure help me live longer, reduce my symptoms, or both? Have I received the best possible medical therapy first? What risks do my age and other medical conditions add to the procedure? These questions encourage a balanced discussion and help ensure that the decision is based on evidence rather than fear. It is also wise to seek a second opinion for elective procedures, especially if the situation is not urgent. Another experienced cardiologist may confirm the recommendation or suggest an alternative approach. Seeking another opinion is not a sign of distrust. It is a responsible step when making an important medical decision that could affect the rest of your life. Remember, successful treatment of heart disease does not end in the operating room or the catheterization laboratory. Long-term success depends on daily habits, taking medications as prescribed, staying physically active, eating well, getting enough sleep, avoiding tobacco, and keeping regular follow-up appointments. These choices often have a greater impact on long-term health than any single procedure. The final surgery on our list is one that affects thousands of seniors every year. It is frequently recommended after years of gradual vision changes, and for many people, it is one of the safest and most successful operations performed today. However, there are still situations where timing, overall health, and realistic expectations are critical. Understanding when to proceed and when to pause can make all the difference in achieving the best possible outcome. The fifth surgery on our list is cataract surgery. At first, this may seem surprising because cataract surgery is one of the safest and most successful procedures performed today. Millions of people have it every year, and for many seniors, it restores clearer vision, improves independence, and greatly enhances quality of life. The purpose of including it here is not to suggest that cataract surgery is dangerous for everyone. Rather, it is to emphasize that even a highly successful operation should be performed at the right time and for the right reasons. A cataract develops when the natural lens inside the eye gradually becomes cloudy. This process usually happens slowly over many years. At first, you may notice glare from headlights at night, difficulty reading small print, or colors appearing dull. Some people simply think they need stronger glasses, when in reality the lens itself has changed. Many seniors become anxious as soon as they hear the word cataract. They worry that waiting even a few months will cause permanent blindness. In most cases, that is not true. Cataracts usually progress gradually, giving you and your eye specialist time to decide when surgery will provide the greatest benefit. The decision should be based on how much your vision is affecting your daily life, not just on the appearance of the cataract during an eye examination. For example, if you are no longer able to drive safely, have difficulty recognizing faces, struggle to prepare meals, or frequently trip because you cannot see clearly, surgery may significantly improve your independence and safety. On the other hand, if your vision is still allowing you to perform the activities that matter most to you, your doctor may recommend monitoring the cataract until it becomes more limiting. Preparation before surgery is just as important as the procedure itself. Diabetes should be well controlled because high blood sugar can affect healing and vision. Blood pressure should also be stable. If you have other eye conditions such as glaucoma or age-related macular degeneration, your ophthalmologist will discuss how these conditions may influence the expected results. Cataract surgery can improve vision affected by a cloudy lens, but it cannot reverse damage caused by other eye diseases. Another important point is setting realistic expectations. Many people expect perfect vision immediately after surgery. While most patients experience significant improvement, the eye still needs time to heal. Some people may continue to need glasses for certain activities such as reading or driving. Understanding this beforehand helps prevent disappointment. Following instructions after surgery is essential. Eye drops reduce inflammation and help prevent infection. Rubbing the eye, lifting heavy objects too soon, or ignoring follow-up appointments can increase the risk of complications. Although serious problems are uncommon, they can occur if postoperative care is neglected. Healthy habits also support eye health. A diet rich in colorful vegetables, fruits, and foods containing vitamins and antioxidants helps maintain overall eye function. Protecting your eyes from excessive sunlight with appropriate eyewear, staying physically active, controlling blood pressure, and avoiding smoking all contribute to healthier vision as you age. One benefit that is often overlooked is the reduction in fall risk. Poor vision is a major cause of falls among older adults. Restoring clearer sight can improve balance, confidence, and the ability to move safely around the home and outdoors. For many seniors, this improvement has a positive effect on overall quality of life that extends far beyond simply seeing more clearly. Before agreeing to cataract surgery, ask yourself a few practical questions. Is my vision truly limiting the activities I value most? Have I discussed all my treatment options with my eye specialist? Do I understand both the benefits and the small but real risks? Am I prepared to follow the recovery instructions carefully? These questions help ensure that surgery is chosen at the most appropriate time. The most important lesson from today's discussion is not that surgery should be feared. Modern medicine has saved countless lives through remarkable surgical advances. The real lesson is that every operation should be guided by careful judgment, individualized evaluation, and thoughtful preparation. Age alone should never determine whether you have surgery, but age does make preparation, timing, and overall health even more important. In the final part, we'll bring all 5 surgeries together. Discuss the questions every senior should ask before signing a consent form, and review the simple lifestyle habits that can dramatically improve both surgical outcomes and long-term health. As we come to the end of this discussion, I want you to remember one simple message. The purpose of this video was never to make you afraid of surgery. Fear is not a good guide for medical decisions. Knowledge is. The best decisions are made when patients, families, and doctors work together, looking not only at the disease, but at the whole person. Modern surgery has transformed medicine. Procedures that were once impossible are now performed every day, saving lives and restoring health. Thousands of seniors undergo operations every year and recover beautifully. But the greatest mistake we can make is believing that every problem has to be solved with an operation. Sometimes surgery is exactly the right answer. Sometimes it is better to wait, prepare the body, or explore other treatments first. Whenever a doctor recommends surgery, pause for a moment and ask yourself a few important questions. Is this surgery an emergency, or do I have time to think? What will happen if I choose to wait for a few weeks? Are there medications, physical therapy, or lifestyle changes that I should try first? What are the benefits and what are the risks for someone my age and with my medical conditions? These questions do not challenge your doctor. They help create a partnership focused on making the best decision for you. Never feel uncomfortable asking for a second opinion when the surgery is elective. Medicine is a science, but it also involves judgment. Another experienced specialist may agree with the recommendation, or they may suggest a different approach. Either way, you gain confidence that your decision is based on careful evaluation rather than pressure or fear. Preparation before surgery is just as important as the operation itself. Think of it like preparing for a long journey. You would never start a difficult trip without checking your vehicle first. In the same way, your body should be as healthy as possible before entering the operating room. If you have diabetes, work with your healthcare team to improve blood sugar control. If your blood pressure is high, make sure it is well managed. Review every medication with your doctor so there are no unnecessary risks. Eat enough protein to support healing. Stay hydrated unless your physician has given different instructions. These simple steps strengthen the body's ability to recover. Physical activity remains one of the most powerful medicines available. You do not need intense workouts. A daily walk, gentle stretching, balance exercises, and light strength training, if approved by your healthcare provider, can improve circulation, strengthen muscles, and reduce recovery time. Every small improvement before surgery increases your body's reserve for healing afterward. Sleep is another powerful form of medicine. During deep sleep, the body repairs tissues, strengthens the immune system, and restores energy. Many people underestimate how much poor sleep slows recovery. Creating healthy sleep habits before and after surgery is one of the easiest ways to support healing. Nutrition deserves equal attention. Colorful vegetables, fruits, whole grains, beans, healthy fats, and quality sources of protein provide the vitamins and minerals your body needs to repair itself. Good nutrition is not only about healing wounds, it supports your heart, muscles, immune system, and brain throughout the recovery process. Do not underestimate the importance of family and friends. Recovery is easier when you have people who can help with meals, transportation, medications, and emotional encouragement. Healing is not only physical. Feeling supported reduces stress and often improves motivation during rehabilitation. One of the most overlooked goals after surgery is maintaining independence. The real success of an operation is not simply surviving it. Success means returning to the activities that bring meaning to your life, walking without fear, spending time with grandchildren, gardening, traveling, cooking your favorite meals, reading a book comfortably. These everyday moments are what truly define health. Remember the 5 surgeries we discussed today. Spinal surgery for chronic back pain should be considered carefully because not every abnormal scan requires an operation. Knee replacement can be life-changing, but the best results come when the timing is right and the body is well prepared. Gallbladder removal is essential in some situations, but not every gallstone requires surgery. Heart procedures can save lives during emergencies, yet elective treatment should always be based on a complete understanding of the benefits and risks. Cataract surgery restores vision for millions, but even this common procedure should be performed when it truly improves daily life.